So welcome, Jen.
Oh,
Nice to
nice
see
to
you.
meet you.
So it sounds like you have been quite busy. You've lost over 150 pounds, it sounds like. It's mostly diet and exercise.
Yes, and a little bit of
Little Manjaro as
yes,
well.
yes. I,
Yeah. So you were interested in, it sounds like, in basically most every area that we see. So it's quite common. So we've seen people who have lost well over 200 pounds. Lots in the 80 to 120 pound range, but everybody really uh, sort of recovers differently from that change, and it really depends on the time, your own genetics of your skin in terms of how much elasticity you have, which is an age-related thing. So folks that lose earlier, usually the skin shrinks a little bit better than if they lose later, but everybody's skin's very different that way. So plenty of people, they lose a lot of the skin extra here. Now you can still feel it, but you can't see it, which is nice. Um, Other times, patients will have, looseness sort of everywhere. So, you're not really so much interested here because you've actually done quite well, I think, in terms of how your skin and the neck and the face and the jowl area has recoiled. Your appearance doesn't, speak out that you have been through that. So I guess I'll sort of start with the belly. I know you've already watched the abdominoplasty video that I did, and that really talks about the mini abdominoplasty, full abdominoplasty, extended, and then the circumferential body lift, with or without the potential auto augmentation of the buttocks, which is sometimes asked for. I think you remember that. The circumferential body lift really helps folks with a lot of extra skin out on the sides of their hips. Those folks really benefit the most. And I didn't talk in that video about the fleur-de-lis, which can be done with an abdominoplasty for just the front, or it can be done with the circumferential. And the fleur-de-lis involves removal of skin vertically in the abdomen. So that's for folks that have vertical laxity or horizontal laxity as well as vertical laxity. And so that's an extra incision. I tend to offer that more often when folks already have a scar there, because it makes the whole procedure a little bit easier, and then I can really tighten things up. If you don't have a scar there and you don't have that much laxity there, then sometimes it's not worth the scar. Um, so there's that, and that's oftentimes done kind of by itself. Now, I can do an abdominoplasty with, say, the breast, like a lift, or with the a brachioplasty, arm lift, which you mentioned. Um, but I can't do a circumferential with either of those because that's would take up all the operative time. So I really try to limit the operative time down underneath 6 hours. So that usually allows me to do 2 locations or 1 circumferential. So the brachioplasties, I see that quite often of folks coming in, and it is a sacrifice, or a trade-off. You're trading off the extra skin, and not just the appearance, but the feel of it going back and forth in so many different, times during the day. It's what I hear. Yeah, that fullness. So I make my incision right where a sleeve seam is, right where behind the back of the arm. I extend it down underneath the bra roll because it will create a little extra skin wherever, well, not apparent, I should say, apparent extra skin wherever the incision stops. So I try to stop that incision underneath where the bra strap would be, so there won't be a lap there. And then I usually try to stop the incision shy of the elbow. It takes about 6 months to a year for it to really fade out and not be so visible. But folks are pretty uniformly quite pleased with that. That usually takes you about 2.5 hours. So the medial thigh lift is similar, but much different in terms of the aftercare. So the arms really is not much aftercare. You have glue and stickers, no sutures to come out, no drains. You just sort of hang out for about 10 days and you take the stickers off. Pretty straightforward. Groin incisions are the most commonly infected incisions in all of surgery, general surgery, vascular surgery, and it's just because of moisture that collects there naturally. Whenever there's skin on skin, there will be moisture, and then wherever there's moisture, well, there's bacteria. And bacteria can pretty easily work their way down through a freshly healed incision and get to the buried sutures that are there And then once the bacteria gets on the suture, well, then you'll get a suture abscess. And we've had a very good track record. I'm only having had in all my career one get infected. Um, and that's because we talk to folks about the aftercare. So afterwards, there can be no sweat collecting. So we tell patients that twice a day or even 3 times a day, a very moist, slightly soapy washcloth, and then a moist washcloth that removes the soap. And then really you have to air dry the groin, and then you have to tuck a gauze there and keep it there. And if patients do that, things heal great. And so that again is just glue there, no stickers, no drains there typically. Now sometimes patients will also have horizontal laxity in their thighs, like going all the way down to the knee. And then so we can also do the similar fleur-de-lis kind of approach to the thighs, whereby the incision is all up under in the groin, and then a vertical incision down the leg. Now that leaves a nice scar there, but once again, it's a trade-off, for the amount of extra skin that you would have.
now does that lift the extra skin off the thigh and up?
It won't pull up the skin of the knee down, the interior skin. It will tighten, interiorly, going straight down the from the groin to the inner knee. It will tighten that area up. Um, but So we have a great way to lift the lateral thigh. We have a great way to lift the inner thigh. We don't have a great way to lift the anterior thigh because no one really, to my knowledge, makes an incision that crosses the front of the leg to lift that skin up. There's so many lymphatics and things in the groin there that I'm afraid you'd end up with leg swelling. So we have solutions for most things, but not, everything. Um, let's see, what else is there? So breast lift, that is something I do, quite commonly. And again, that takes about 2.5 hours. So that can be done along with a brachioplasty or along with a thigh lift. And the breast lift always involves, incisions around the nipple, and an incision that goes down to the fold. And then with a weight loss patient, usually there's extra skin and the incision extends a ways across the fold. I never really connect them in the middle, which I've seen done. So go ahead.
With the lift, is there a way to make it look more proportionate?
Meaning like adding volume?
To add volume.
So yeah, so one of a lot of the time that whenever I do lifts, if a patient carries any extra weight, particularly from the belly and the flanks, and some lateral thighs, I can harvest fat, and I can harvest fat from underneath the skin that I'm going to remove, and I can take almost all that fat, whereas I couldn't have taken it if I were leaving it, right? So I can harvest some skin. I can harvest the fat from underneath the abdominoplasty skin or skin elsewhere. And then, yeah, we can graft that. And I usually do graft it into the upper pole of the breast because the lift usually adds volume down here, but it doesn't necessarily add volume way up here or towards the middle. So I'm usually putting grafting the fat on the top and then the central breast. So, yeah. I don't usually put in implants at the same time, particularly in weight loss patients. So weight loss patients have this ability their skin will stretch again. And that's one of the reasons why they heal so well, and the risks of the surgery of healing difficulties is pretty minimal in weight loss patients because, their skin used to have blood flow that needed to be twice as much as it is now. So there's sort of extra flow, and then the skin has that extra stretchability. So I don't think problems with blood flow to the wound edges is really hardly ever a problem with a weight loss patient. The downside of that is that I have seen like patients that have a lift. We tighten things up, and it's possible that they will feel looseness again later. And so sometimes we'll come back after about 3 months and either put an implant in or do a round of fat grafting. Because the skin does tend to give, because it used to be so much larger. That make sense?
It does make
Did
sense.
I cover all your bases?
I think you did.
All right. Well, thanks.
I appreciate that.
If you get questions, feel free to give me a call.
All right.
All right.
Thank you.
Yep. My pleasure.